شنو infancy، شنو premature، شنو full term. كل واحد من عندها ذني في definition خاص. راح نبدأ بالديفينيشن المهمة بالنيوناتولوجي اللي هي أول وحدة مثلا في natal period defined as a period between 2 18 week gestation through 7 days of life after birth. Neonatal period is defined as a period between first day of after birth to the first 28 days. طبعا قسم منهم يسوونها يعني subdivision to very early in the first day, early in the first week, and late from the 7th day to the 28th day. Postnatal period, it's begun after 28th day of life, extend to the end of the first year. Infancy is defined as the first year after birth. Premature live birth, it's infant delivered before completed 37 week. يعني 36 plus 6 days, it's premature. 37 week, complete 37 week from the first day of the last menstrual period is defined as premature. Early full term, it's completed 37 to 41 week. طبعا ممكن يقسموها إلى early term بال 37 to 38, full term 39 to 40, and late term اللي هي 41 to 41 plus. Early term was previously referred as late preterm. Extremely low birth weight, very low birth weight, less than 1,500 gram or less. Low birth weight less than 2,500 gram or less is a consequence أما prematurity أو poor intrauterine growth. طبعا إذا poor intrauterine growth يعني هو full term but small or low birth weight ما راح نسميه أكيد premature، راح نسميه more for gestational age. Normal average birth weight is 3.5 kg and 50 centimeter length. Premature newborn, every year about 15 million of newborn born prematurely. This number is rising. يعني قبل كان ماكو premature labor أو قليلة، هسه لا كلش هواي. طبعا because the healthcare become more better يعني as a gynecologist and the pregnancy of fetal pregnancy and artificial pregnancy IVF also increase, so the rate of the premature increase. It's about 5% to 18%. There are many risk factors for premature labor, مثلا multiple pregnancy or twin, previous premature labor, short period between pregnancy, preeclampsia, smoking, uterine cervical abnormality, recurrent infection, chronic illness, abortion, mother age, كل ما mother age أقل كل ما liability for premature labor تكون أكثر. Clotting disorder, alcohol and drug abuse, hereditary acute يعني هو habitual يعني hereditary familiar. Preterm premature rupture of membrane and يسموها بروم. There are maternal cause include also there are another item هو IUGR intrauterine growth retardation. هذا مو مثل premature. الفكرة بالpremature إنه البيبي delivered prematurely, so the growth parameter of the newborn is affected. يعني اللي هي شنو بالنسبة للنيوبورن اللي هي الويت، اللينث والهيد circumference. الIUGR لا، الIUGR يجينا full term يعني 37 38 لكن مو نشوفه لا هو small. زين small for gestational age. زين and the growth parameter are affected. يعني يا اما نلقى الويت مالته قليل يا اما نلقى يعني او الافكشن مالته بالويت. اذا severe IUGR اللينث also affected. If it's more severe the OFC also may affect it. IUGR present when fetal growth stop and over time decline to less than 5 percentile of the growth for gestational age, or growth proceed slowly, but absolute size remain less than 5 percentile. May result from fetal condition or maternal condition. If fetal condition, then intrauterine infection, heterobilium, dwarfing syndrome, chromosomal abnormality, congenital malformation, and reduced fetal production of insulin and insulin-like growth factor. Placental causes of IUGR include bilitis, congenital infection, placental tumor, chronic abruption of placenta, twin-to-twin transfusion syndrome, and placental insufficiency. Maternal cause of IUGR include severe peripheral vascular disease that reduce uterine blood flow اللي هي على رأسها طبعا chronic hypertension, diabetes, vasculopathy, and preeclampsia and eclampsia. Reduce nutritional intake, alcohol or drug abuse, cigarette smoking, and reduce weight gain during pregnancy. The outcome of IUGR طبعا أكيد depends on the cause of the on the IUGR and associated if it's associated with complication after birth or not. This picture shows the difference between premature infants on the left. هذا premature infant. طبعا راح يشوفون انه كل البارامترز مالته affected, الهيد, الويت and this picture represent both infant or both neonate at the same gestational age 38. but شوفوا يعني طبعا شوفوا الفرق انه هذا البيبي full term healthy wealthy شوفوا الفات باد، لكن هذا هو نفس الجستيشنال ايج لكن small short thin. طبعا شوفوا اللوكينج مالته طبعا اللي مبينه بالصورة اللي هي circumference affected but a little bit. يعني شوفوا اللوكينج مالته يعني هو اورينتد، يعني اللي يشوف اللوكينج مالته واللي يشوف صاحبه وشيء يعني امور ماشيه، لكن شنو الافكشن اوف all growth parameters. نرجع للديفينيشن. عندنا هم perinatal mortality referred هي fetal death occurring from 20 week of gestation until 28 days after birth. It is expressed as number of deaths per 1,000. Stillborn are those born without heart rate and epinephrine cyanosis. Intrauterine fetal death accounts for 40 to 50% of perinatal mortality rate. The neonatal mortality rate includes all infants dying during the period from after birth to 28 day of life. طبعا infantile mortality هو death occurring in the compressive neonatal and postnatal period. Major cause of perinatal and neonatal mortality عندنا fetal cause وتنقسم هماتن fetal cause اللي هي intrauterine، وعندنا لا newborn causes اللي تتعلق بالإنفانت وممكن نقسمها إلى preterm شنو وإلى full term شنو. fetal cause intrauterine abruption of placenta, chromosomal abnormality, congenital malformation, hydroxyuterus, intrauterine asphyxia, intrauterine infection, maternal underlying disease, chronic hypertension, autoimmune disease, diabetes mellitus, multiple gestation, placental insufficiency, and umbilical cord accident. The baby cause or infantile cause ممكن تنقسم according to the gestational age. The preterm infant, the most common cause of perinatal mortality هي respiratory distress syndrome. Later on bronchopulmonary dysplasia هي طبعا تعتبر chronic disease. Severe immaturity, congenital abnormality, infection, intraventricular hemorrhage, necrotizing enterocolitis. If it is full-term infant, birth asphyxia anatomical list, birth trauma, congenital anomaly, infection, macrosomia, mucolium aspiration, pneumonia, and persistent pulmonary hypertension. assessment of newborn. طبعا احنا intrauterine نعرف اللايف هي شنو. intrauterine life. لكن postnatal, after delivery, there are some changes or some points occur in the infant, so we can live أو this transformation. طبعا احنا خلينا نعرف حد البداية. هو بالنيونيت شو راح يكون؟ بالنيونيت طبعا عندنا placental blood يجي من البلاسنتال من الامبلاكتال فين، طبعا اللي هو يكون high resistant. الpulmonary system not functioning زين و high resistance and high pressure in the pulmonary area. اللي حيكون شنو الترانسبوزيشن from the fetal life to neonatal life راح يصير 4 شغلات 4 things. أول شيء removal of low resistant circulation of the placenta, the onset of breathing, reduction of pulmonary arterial resistance and closure in the uteral shunt. شلون هاي تكون؟ طبعا احنا اول ما يجي البيبي ايش حنسوي له؟ حنسوي له كلامبينج للامبلايكال كورد. الكلامبينج بالامبلايكال كورد يعني انا ايش راح اسوي؟ راح اقطع منه البلد سبلاي. زين الكلامبينج اوف امبلايكال كورد راح يسوي لي elimination of the marker. اوكي ايش راح يسوي لي؟ راح يسوي لي elimination of the low pressure systemic of placenta and increase systemic pressure, systemic blood pressure. زين نقطع لنا البلد سبلاي ايش راح يقل؟ راح يقل الفينوس ريتيرن. زين وما راح يقل الفينوس ريتيرن لل right side of the heart and decrease the right arterial pressure. قللنا البلد سبلاي وبالتالي شو راح يكون؟ راح نقلل البريشر. زين الخطوة الأولى احنا سوينا كلامبينج. الخطوة الثانية البيبي راح يسويها هي البريدنج أو الكراينج. When the baby starts crying or breathe, the air will fill the lung fluid. It will open the alveoli. So when it open the alveoli, it will cause the vasodilatation. So the pulmonary blood flow will decrease the resistance of pulmonary blood flow. So the fluid leaves the lung. يعني احنا ما بس اثرنا على الفاسكولار ريزيستنس اوف ذا الفيولار وول، ايش راح يصير؟ اكو فلويد كان موجود باللنج، وين حيروح؟ يا اما طبعا هو اكيد ليف ذا لنج in parts from trachea outside اللي احنا راح نسوي له section طبعا or swallowed to the stomach or squeezed out during the vaginal delivery. Pulmonary lymphatic and venous system reabsorb their remaining fluid. احنا بالprocess of breathing ايش حنسوي؟ أو شو حيصير؟ pulmonary vascular resistance will decrease, so the pulmonary vascular decrease, the systemic pressure will decrease, and eventually the ductus arteriosus will close. So the heartbeat will pump the blood to the whole of the body and to the lung. What's the routine care of neonates or neonatal care in the delivery room and resuscitation? Approximately 5 to 10% of newborn require active resuscitation. يعني من كل delivery 10% ومن كل 1 delivery 100 delivery 10% may normal and hence birth asphyxia may be unpredictable. يعني رغم انه كل ممكن الهيستوري يكون نيجاتيف، ممكن الليبر او البيرث هيستوري ممكن يكون نيجاتيف، لكن يجي البيبي birth asphyxia unexplained. البيبي من يجي لازم يشوف calculate Apgar score. Apgar score هو a practical method or systemically assist the newborn infant immediately after birth. Apgar score significance من عنده هي شنو؟ هي إنه determine if the baby need resuscitation or not. Just قبل كان يعني يوجد أهمية كبيرة، هسه لا، يعني إحنا الأهمية مالته just to know if the patient need resuscitation or not we calculate it at 0 immediate after birth, or 5 minutes, 10 minutes, 15 minutes, and 20 minutes. أبجار سكور calculated from this table. الأبجار سكور هو يعني abbreviation of 5 words: appearance, pulse, grimace, activity, respiratory effort. Baby يجينا الappearance مالته blue or pale نعطيه 0. body extremities blue لكن هو centrally pink نعطيه 1. completely pink نعطيه 2. pulse if absent نعطيه 0. less than 100 نعطيه 1. more than 100 نعطيه 2. وهكذا. جمع الأبجار score. if the Apgar score more than 7, it's need just routine care اللي هي warming, drying, clearing and cleaning. if need by either replacing head. طبعا السكشن ممكن يا اما يعني place the head downward or by يعني sucker or NG tube. طبعا هو الموست يعني common by NG tube. not يعني enforce the NG more than 4 to 5 cm from mouth to nose. If the newborn has low Apgar score, it's 7 or less. يعني more than 7, it's no يعني need routine care. If 7 or less, it's need ABCD. A. Airway, secure patent airway, clearing the amniotic fluid or meconium bisection. B. Representative breathing if neonate is ethnic or hypoventilated and remains cyanotic. اللي هي artificial ventilation should be initiated اللي هي positive regular ventilation PVV. Ventilation should be performed with a well-fitted mask attached as a manometer to prevent extremely high pressure from being given to the newborn. الأنبوبة كلكم شايفيها بيها valve pressure. طبعا هاي الأشياء راح تشوفوها وراح تاخذوها بالديتيلز بالعمل. الأنبوبة بيها valve، هذا المانومتر حتى الهواء اللي ندفع للبيبي يكون كنترول يعني مانومتر pressure كامل حسب according to the valve. 100% oxygen should be administered via mask. The valve of أنبوبات أو mask of أنبوبات طبعا should be fitted at corrected side. يعني should cover the nose and mouth, not reach to the eye, and not so small بحيث يعني not covering all the whole area and not covering the chin. At the correct position, the anatomy is correct. C. Represent circulation of the external the 120 compression per minute with compression rate given duration, one ventilation. D. Represent the administration of the drug if bradycardia is irresponsiveness. 2. Ventilation or if assistol is present. Epinephrine should administrated intravenous epinephrine. Dilution amount 1/10,000. Indoors 0.1 to 0.3 mol per kg per dose should be given through umbilical venous line or injected into endotracheal tube. This table shows the neonatal resuscitation algorithm. كل neonatal resuscitation room راح تكون هذا الالجوريثم موجود. جدا مهم. طبعا قلت لكم راح ناخذ الديتيلز بالعملي. بس بمختصر when يجينا البيبي we should ask 3 questions, important questions. If it is full term or not, breathing or crying or not, good tone or flowing. All these questions are yes, stay with the mother, continue the routine care, warming, cleaning, drying, ongoing evaluation. One of these is no. If it's not crying, if it's flowy, if it is premature, we should keep in our hand. Warm, clear airway, if necessary, dry, stimulate. If it starts crying and heart rate well, breathing well, heart rate above 100, just routine care. If the heart rate is below 100, gasping, bleeding, apnea, so we start PBV. PBV اللي جينا هي through أنفوباك. الأنفوباك طبعا for full 5 inflation in rate of 1 to 3, 2 to 3, 3 to 3, 4 to 3 and 5 to 3. طبعا القسم مكتوب بالعكس بس عادي. For 5 cycle, full pressure. If it is not responding, we يعني طبعا with monitor. If the heart rate is still less than 100, or the breathing still floppy, gasping, then we use or we do another circle of ventilation with corrective step. طبعا هاي الخطوة كلها هتجيب in the first 1 minute. يعني احنا أول 30 minutes أول 30 seconds أول 30 seconds نسوي warming, cleaning, general care. If it's not getting well, the heartbeat below 100 or gasping breathing, we should start positive ventilation after the 30 seconds and within the first 1 second. اللي يسموها طبعا golden minute. So, the corrective step اللي هي jaw thrust or extension of the neck. For another 5 cycle, if it is responding, we go to the post-resuscitation room. If it's not responding, we check the heart rate. If it is below 100 but above 60, recheck or recycle the positive pressure ventilation. If it is less than 60% or 60 cycle, 60 beats per minute, so we consider intubation, chest compression in coordination with PBV. Chest compression in the rate of 3 to 1 ventilation and endotracheal tube. This we will do it for 15 seconds. And if the heart rate is rising above than 60, we go step back, take ventilation corrective step, and step back. If the heart rate is still below 60, we enforce to give him the epinephrine or drug. Epinephrine should be remembered. You should بالعربي لازم تحفظون هاي الأشياء. لازم تحفظون the drug of resuscitation. The step of resuscitation is very very important in our real life. لأنه أنت حقيقة يعني هو أهم شيء هو resuscitation. يعني إحنا من طالب يعني الطبيب إنه يعرف small dose of يعني rare antibiotic. لكن resuscitation drugs are very very important in real life and in the exam. We give epinephrine and we can يعني redose the epinephrine for 3 times. If it is still below 60, take ventilation corrective step. طبعا إذا شفنا إنه أكو response, okay. If it is not response, we should keep in our mind أما equipment يعني defect, leak in air source, leak طبعا in air source or in the lung يعني صار pneumothorax or hypovolemia طبعا فننطي مثلا shoot 10 cc of normal saline 10 cc per kg normal saline within 10 minutes or pneumothorax. This algorithm represents the resuscitation step. It's very important to know, very important and vital to do. قلنا لكم routine care in delivery. طبعا الروتين care in delivery after resuscitation, after warming, cleaning, clearing, what we do to the neonate before we give the neonate to the mother. First of all, we give him erythromycin eye drops to prevent neonatal gonococcal or chlamydial eye disease. Vitamin K prophylaxis intramuscular should be given to all infants to prevent hemorrhagic disease of a newborn. It's a very important step. Before discharge, infant should receive the hepatitis B virus, B screen for virus disease. Nowadays, we add BCG vaccine and OPV
first or 0 dose in the labor room. So we have 5 drugs or 5 medication given to the neonate in the as a routine care in the delivery room. 3 vaccine and يعني نقول 1 antibiotic and 1 vitamin. Physical examination and gestational age assessment. يجينا البيبي طبعا الجاينيكولوجي مثلا يقول لنا يابا انه هاي 37 ويك 38 ويك زين، بس احنا لازم نعرف انه هذا ما انتظر انه الجاينيكولوجيست يقول لي، لازم انا اعرف من اشوف البيبي انه هذا هو فول تيرم ولا بري تيرم. طبعا عندنا physical criteria of maturity وعندنا neurological criteria. physical criteria of maturity with advancing of the age, the increasing of firmness of the pinna of the air, increased size of the breast tissue, decrease fine immature lingo hair over the back, and decreasing opacity of the skin. الأشياء الحزود طبعا firmness of the pinna, size of the breast tissue, decreasing fine hair, immature lingo hair over the back, and decreased opacity of the skin, and the genitalial maturity. أكو neurological criteria. Neurological criteria mature with gestational age, including flexion of the leg, hips and arms, increasing tone of the flexor muscle of the neck, and decreasing laxity of the joint. This table called بيلارد chart. البيلارد chart هو شنو؟ طبعا هذا راح يشوفوه هم بالسنين يعني بالنيوناتال كير يونت. البيلارد chart من خلاله طبعا هو هم سكور، نشوف السكور ونعرف من خلاله الجستيشنال ايج. السكورز minus 1 0 1 2 3 4 5. السكن إذا شفناه مثلا sticky friable transparent يعني بحيث underlying vein and arteries obvious نعطي minus 1. gelatinous red but still translucent نعطي 0. إذا smooth pink visible vein 1 وهكذا. طبعا هو هذا حقيقة difficult to remember، لكن انتو الفكرة من عنده انه نعرف من يجينا البيبي انه ناخذ السكورز of each criteria then collect it. هذا طبعا بالنسبة للفيزيكال ماتوريتي. اكو نيوروماسكولار ماتوريتي اللي احنا قلنا البوستشر، السكويرنج انجل او يسموها السكوير ويندو اوف ذا ريست، الارم ريكويل، البوبليتيال انجل، سكارف ساين يعني ناخذ الارم right arm and pull it to the left side and see with the extension لوين توصل، يعني إذا راحت ل another side completely نعطيها -1، إذا not completely or يعني صارت نسميها بزاوية منفرجة نعطيها 0، إذا زاوية قائمة نعطيها 1، إذا زاوية حادة نعطيها 2، إذا صارت لا يعني just the elbow flex نعطيها 3 وهكذا. all of these collect نعطي سكور ونجمعها ونخليها على السكور يطلع لنا gestational age. الأذر كرايتيريا اللي هي لا طبعا السمبل كرايتيريا وما تحتاج تيبل أو شيء، نحتاج ال thickness of the sole if it's thick and the lines appear full term, the nipple if it's appear and colored full term, the pinna if it's recoil and firm full term, the lingo hair if it's disappear it's full term, and the genitalia the closure طبعا بالنسبة للفيميل closure of the labia rogi and thick scrotal skin in the neck. These signs يعني give us a simple idea if the baby is mature or premature. Thank you. We end to the end of our lecture. اللي عنده سؤال ينطينا إياه على الشارت. وأني وياكم.